We're talking today about HQIP's recent Clinical Leadership Seminar, which took place on the 27th of May at the Oval in London. Very successful event. Can you tell us a little bit about the context of the event and why we held it and who was there?
Right, so in fact we invited all the clinical leaders, so we had about 70 clinical leads. That is the National Audit Programme, those who lead it were invited, and we had a very good attendance from the National Audit Group. Why did we hold it? Right, so we've been running a thing called the Consultant Outcome Programme, which has had a yearly event. So in that context, we wanted a further event, this time with the wider clinical audit community. And we wanted to highlight a few areas. Firstly, and probably most importantly, we wanted to highlight the move from Consultant Outcome Programme to Clinical Outcome Programme, with the emphasis on the fact that actually we have got large numbers of team-based audits, and that this is core business for us, core business for NHS England and for CQC, and it was to celebrate with colleagues who run these audits that their work that they're doing in the audits. And I guess the other thing to do with the nuts and bolts of the events was to have an interface between these colleagues and Bruce Keogh, NHS England, and Mike Richards, CQC. Obviously for NHS England and CQC, the audits are very important. There's really high quality data coming out, and it was really to celebrate that interface, and I suppose the most important part of all the meeting was to celebrate the leadership that we see in the National Audit Programme. It can be a lonely place to be sometimes, leading one of these audits, and it was to celebrate that leadership and actually ask what is it we can do to help in that role that many of these clinicians end up in.
Okay, because I know that there was a great deal of discussion, maybe as you'd expect, around the fundamentals of audits, so things like the methodological approach, how audits are reported, and the impacts they have. Yeah. Do you want to expand on some of those themes?
Yeah, of course, in any audit meeting, that's pretty fundamental methodology. So it was a discussion like, are we measuring the right things? Bearing in mind, quite a few of the audits go back quite a long time, and life changes. Are we measuring the right things? Is it the right thing for patients? And then for others involved, commissioners and the like. So it was that bit. And then I think the really important thing was to bring home to colleagues that actually, are their reports really having the impact that they maybe think they are, but maybe not. So basically, if you produce a 100-page report, the medical director in the trust is not going to read it. So how can we help the audit providers to produce a report that really has an impact? And indeed, we presented this document, which you'll know, the Reporting for Impact document. So what are the 3 key questions, 3 to 5, and what are the 3 to 5 key findings? And are you really hitting in on those? And what about different techniques? Like, for instance, are you using infographics, social media? Are you getting the message out to all of the audiences, clinicians, the trust managers, medical directors, commissioners, and of course patients? So it was really just to bring all of that into the mix.
I know there was a lot of debate around the timeliness of reporting. It's an ongoing discussion in audit. And can you sort of expand on that a bit? I mean, real-time audit was discussed in some length, and I'm aware there are some good examples of that already, but is that very possible for many of the audits, and why is that so important?
The answer is it is incredibly important, and it is possible for most of the audits, and it was well discussed, James, as you know. But just to give the principles as I see it, so essentially if you do the traditional audit whereby collects data 31st of March, processes, something comes out in late autumn, and actually what does that really mean? It means you're looking at data pertinent to 18 months before. Now actually, surely we can do it better than that, and there are ways of doing it better. So national audit is local audit data aggregated nationally. So it leaves the trust, gets washed, comes back. But actually, surely you should be using it in the institution, real time. and there's nothing to stop you using it real time. Okay, so you miss the kind of washing bit, you miss the benchmarking bit, you maybe miss the risk algorithm, but the risk algorithm from last year, it doesn't change greatly each year, so there is ways of doing it. And so I think our role in this will be to point out Unit A, they're doing it really well, can they help the unit down the road, so that we all start using real-time data. Now, why is that important? It's important because if you find out 18 months hence that there was a problem, it's too late. So why not try and pick it up early, so if somebody or a unit is deviating off, it's picked up quickly, action takes place, and so it comes back in. Great for patients, great for units, and really good for individuals, so that they never appear in the headlines as an outlier. You know, what we want is no outliers by virtue of a really strong governance setup using the good data, the real data in the unit, real time.
Excellent stuff. And inevitably, Outliers leads us on to that, and that's always a strong debate in any kind of audit environment.
Yes.
Again, it came up at the leadership seminar. Can you tell us a bit about some of those challenges and how people might surmount them, and how HQIP might support them in doing so?
Yes, James, that was and it was a really good part of the meeting. Not the discussion of outliers, but the discussion with colleagues who'd had to deal with outliers. You might recall Steve Homburg, Medical Director in Brighton, Graham Cooper, who leads the cardiothoracic surgeons, both gave short presentations. How was it for me? And they were really powerful. Steve pointing out the open approach, involvement of board, involvement of unit, involvement of all in the unit, so that the nurses don't suddenly find out in a newspaper, oh, we're an outlier, and that doesn't make you feel very good. So total involvement of all concerned, and a very powerful, accepting the data, not the denying the data, accepting the data. What can we do to make it better? And Graham coming in the same theme as to how can we, so leading a national audit, how can we help when outliers do flag up? What support can they get? What support do they need? And I think it was a really positive discussion and very helpful. And their actions are coming out of that. Actions for the clinical leads in the audits, who should be supporting the clinical leads in the units. Actions to do with support for the medical directors, because a medical director, this may be the first time they ever tell of this, and the phone call coming in on Friday afternoon, what support do they need? And that is support from the clinical leads in the audit, and there is probably a role for HQIP in this, in supporting all of this. So I thought that was a really powerful part of the seminar, James.
Excellent stuff. And there was some debate around positive outliers as well,
yes.
And if and how we can take that forward. It's quite a tricky subject.
Yes, yes, we've stumbled on the positive outlier thing, the celebrating excellence, as I prefer to call it. And we have a way through that, and that is celebrating excellence in units. And the first thing actually that came out, and we've picked this up, is the data based on excellence being seen has to be robust. When we have celebrating robust data saying excellence, there has to be a way that we and the audit providers will work through to help. So this unit's doing this really well. How can they help the other units? There is no reluctance to that bit. I think there's some reluctance to the kind of publication of it. But, we can work our way through that, particularly if colleagues see that we have helped produce a robust system for helping that spread of the celebration of excellence, and the support to units that possibly aren't doing so particularly well.
Excellent stuff. Another part, this is more of a procedural, day-to-day, ongoing concern for some of the audits and registries, but it's getting access to national data. And I'm aware that came up, and HQIP had some actions to take away from that. So tell us a bit about that.
Yes, it was quite clear. There was quite a lot of unhappiness in the room to do with the HSCIC and that kind of data. So there were important actions, and we have collated. So we wanted to move away from anecdote. So we have collated by surveying the audit providers what actually has been going on. And we have categorised it into, and it's pretty obvious things: delayed data, no data, this has data, and the like. We've passed that on to Bruce, and I know Bruce is taking that through with NHS Digital as now. In addition, however, we ourselves have had very good meetings recently with NHS Digital has a new group in there that we are interfacing with, who fully understand that these annoyances to do with delayed access, etc., etc. I am hopeful, actually, that with that local interface with the NHS Digital, that we will start to see improvements with access to the kind of national HS data.
Good stuff. Well, it sounds like that was a very, there's some very positive steps being made there, and the event itself was clearly a success. So what's the kind of future plans? Are there going to be more of these events? Is this group going to meet again?
Yes, the thing I probably haven't mentioned that came out very strongly was the leadership bit to do with this. And I think the very fact that we were meeting with colleagues, that they had Bruce and Mike there who stayed a long time, and there was very good networking going on. So I think most of the clinical leads in the audit felt, actually, yes, we are important. Like, I know that, but it's getting that message across that they are doing a really important job. And most of us understand that many of this is done by goodwill. And so it's that celebration that, yes, it is a vital job they're doing. Yes, we are planning another event. And indeed, one of the themes that came through would be, and we will do this, canvassing colleagues as to what other themes would they like us to bring forward for a national discussion at this kind of level. And so that's definitely on. And of course, we've got the reporting for impact guidance, the guidance into use of infographics, these kind of practical things that could really, really transform the audits into really, really powerful tools. And then the interface with people like commissioners, and the work, we're doing some work with CQC through the national audit to take the data down and make it so lots of people are producing dashboards. So we're working on how can they use really, really powerful data more easily without having to trawl through pages and pages. So these are various actions that we're taking forward from this.
Excellent stuff. Well, that's all from me, so thank you very much today.
Cheers, James. Thanks.